Hi, this is Dr. Claudia Kim. Today I'm going to be talking to you about a BBL, or a Brazilian butt lift. I'm sure you guys have heard of it. It's huge. It's been huge for the past couple of years, and what we're seeing in terms of trends and kind of the recovery expectations and the risks and perils of the surgery itself. So with a BBL, or a Brazilian butt lift, you're taking fat from somewhere else, and you're essentially doing liposuction of the areas that you are not happy with and using that fat to volumize your butt and your hips. Okay? So usually you are combining it with a liposuction procedure. It's done under general anesthesia in certain situations. If it's just a little bit of fat that you're using to kind of fill in, let's say, just the hip dips, that is something that we can do under local anesthesia. But if you're looking for like a significant cleanup of the abdomen or the back or the arms or the thighs, it is recommended that you go to sleep for this so that it's just much more comfortable for you. Now, recovery and expectations and limitations. So after surgery, right, obviously make sure you keep all of your appointments with your surgeon. Secondly, you are limited in what you can do and in terms of your activity levels and exercise. The biggest one being is that you cannot put prolonged pressure on your butt or your hips, which means sitting and sleeping. So obviously you do need to sit, obviously, to eat, to use the bathroom, but you cannot be sitting in one position for hours and hours on end. I usually like to say, stand up and kind of shift your weight after about an hour or two. There are certain BBL pillows or essentially these little cushion things that distribute the weight to your upper thighs and not putting pressure where the fat was grafted. Why do we need to keep the pressure off this new area that the fat is in? Because the fat needs to settle, it also needs to grow the blood vessels, because blood brings in oxygen and nutrients and keeps the fat alive. So when you put a prolonged amount of pressure, you're kind of suffocating the fat so that the fat isn't able to thrive. Normally, even if you follow all the rules, usually about anywhere from 50%, this is a generalized percentage, that about half of the fat doesn't make it, which means that the other half that is going to survive, we have to make sure that it's getting the nutrients to be able to survive. So it takes about a month, about 30 days for the fat to survive, which means that during this time, the fat has to get the oxygen and the nutrients to keep it alive. So that is why we try to optimize the environment that the fat is in by preventing too much pressure to be on that area with sitting and sleeping. Obviously, the other things that you want to make sure that you're avoiding is using any nicotine products or vaping included, because nicotine can cause less blood to get to the grafted fat, and potentially not have enough fat survival. So especially when it comes to surgeries and cosmetic surgeries, that aesthetics is really big. You do want to avoid any kind of nicotine products 4 weeks before and 4 weeks after surgery, even longer if you do want ideal results. Now, I often get asked, how many sessions of the BBL or fat grafting am I going to need? And that really is patient dependent. So, a lot of the times if you're looking for a significant bump in the booty, you may need more than 2 sessions, even up to 3 sessions, because obviously the skin needs time to adjust. So at the first session, the butt might not actually be able to accommodate all of this fat, because again, you're always overfilling with the anticipation of about half of the fat not surviving. And so a lot of the times people will need multiple sessions to get to the size that they desire. Okay? And usually I do say wait 4 to 6 months in between each session of BBL, just to let your tissues heal, let the rest of the body heal before you end up going through this procedure again. Okay? And again, each time you do the fat grafting, the recovery expectations will reset to square one, where no sleeping or no putting pressure on the butt for 4 weeks. Remember to make sure you have your compression garment. So you should have your compression garment that your surgeon provides for you or recommends, and do your lymphatic massages to make sure that you have optimal healing and the swelling to be minimal at best. So what are the risks and complications of a BBL? This is obviously a big thing in media because of the harm that the BBL can potentially have, such as death and hospitalization. And the reason for that is that if fat gets injected into the major blood vessels of the butt. It is a direct highway up to the heart and lungs, and that's what is called a fat emboli. So imagine that this highway is all of a sudden clogged with this fat particle, and it goes all the way up to the heart. Let's say, the George Washington Bridge. It's going to cause a massive backup essentially to your circulatory system, and pretty much can cause a death even on the table. So macroemboli are like big pieces of fat, and microemboli are little pieces of fat. They're different in their risks and the direness of the situation. If it is a macroemboli, it's going to be a big problem, and that's usually what causes death on the table for plastic surgery patients. Microemboli, it can present as just shortness of breath, or the patient is fine when they go home, and then after a few days from surgery, they start to feel like a little shortness of breath. They're having kind of like, they're getting winded and something like that. You need to go to the hospital for. Okay, that needs to be admitted. It is a big, dangerous situation. So obviously make sure that you are in close contact with your surgeon or your surgical team to keep them updated about any of these symptoms that you might be experiencing. One big thing that has become much more common is that the surgeons are now being regulated to avoid any fat injection into the muscle, because the blood vessels are within the muscle. Previously, surgeons would inject into the muscle because it does give you a little bit more volume. Because again, muscle is where all those important blood vessels lay, and so that if you are injecting in the subcutaneous space, so the space above the muscle, the chances of having these fat emboli are much, much lower. So depending on the state that you're doing surgery in, those regulations are a little bit different. So in some states, they do require using an ultrasound, so you're using a device inside the operating room so you can actually see where the fat is getting injected to ensure that the fat is not being injected into the muscle layer. Now, not all of the states have actually started enacting this, but I do foresee that it is going to become more of a universal thing. For me personally, yes, I do use ultrasound in the operating room, even though New York does not mandate it. And it's always good when you're looking for a surgeon to ask how they do the fat grafting and what happens if something happens. What hospital is the nearest hospital that you go through, and you just explore and find out what their protocols are for potential adverse events during this surgery. Is there anything else that we could do to prevent the occurrence of the fat emboli? So obviously there are little things, and I'm getting a little bit more technical, but it is about how the surgeon is injecting the fat, at the angle of how the fat is injected. Obviously there's certain red zones that you shouldn't be injecting, but mainly it really is surgeon dependent. So make sure that your surgeon is board certified and they actually know exactly what the regulations are and the complications risk is. So when it comes to the shape of the butt, it can be just a little bit of fat grafting. So let's say you're happy with the projection of your butt, but you have a little bit of the dimpling on the side, what we call hip dips. You can just do fat grafting localized to those areas, versus if you wanted to have a little bit more volume, a little bit more of a shelf. Obviously this is all patient dependent, and so you can kind of customize your ideal shape with the surgeon prior to having the surgery done. And there are obviously different types of butts, or where sometimes you might want a little bit more of a heart shape, as in you want the volume to be kind of on the lower half of the gluteal region, or let's say you want a little bit more of a shelf, so in that sense you inject more of the upper pole of the buttocks. So make sure that you have an ideal shape. It's always nice to have some wish pics that you can bring with you on the day of consult, just so that you and your surgeon have the same idea of what you consider to be a nice shape. And obviously, we are seeing a little bit more, or we're actually seeing a little less of the volume and the projection throughout the years. Plastic surgery is just like trends. We do see sometimes things get a little popular and then it starts to kind of become a little less popular. And so we are starting to see a decrease in the number or the incidence of BBLs that are really large. And so now we're starting to see like more shapely, more shapes. And I've talked about this before on the ballet body. So people are looking to be more toned, a little bit on the leaner side. And you can use fat grafting as an adjunct, either to define muscles in the high def. I love how everything is connected, right? And so you can use fat grafting to accentuate the lines in the abdomen, the musculature in the biceps, or you wanted to address the hip dips that we commonly see within athletic bodies. So we always kind of take into consideration what is in at this time to make sure that you are not doing something so crazy that 5 years later it might not be in style anymore. So again, speak to your surgeon and come up with a plan that is right for you. So speaking from personal experience, I have had individuals who have done a BBL in the past and has found that it was just way too much for them, and so they're asking for a reverse BBL. So these tend to be a lot more trickier to do. It's much easier to add than it is to take away, funny enough, and a lot of the times some surgeons may not want to do that because it's just easier to be predictable when you're adding fat, but when you're taking out fat, it is much more complicated. But again, it is possible with the right surgeon, whether it be with liposuctioning out the fat that was previously put in, or, and I'll talk about this in another video, called the droopy butt syndrome or the diaper butt syndrome, is when there has been a lot of fat that was harvested or grafted into that site, so things are starting to sag. In that situation, it may need a little bit more extensive surgery than just liposuction, and you may require what's a posterior butt lift, or essentially lifting up the tissues that have sagged and descended down after a big BBL. So obviously, speak to your surgeon about different options and to figure out the right plan. Hopefully you guys learned a lot about our BBLs. If you like these videos, stay tuned for more to come. Bye.